that the DDA is having a meeting tomorrow. The link to that meeting is here in the PowerPoint, and imagine in the chat. You can check both places. We're going to talk about it again throughout the presentation. It is at 2:30 to 3:30 tomorrow. When you see the meeting announcement, there's a link there to attend. There is not a specific registration. In their DDA's announcement, they also had a place where you could click on the link and put in questions. We are encouraging all of you to send your questions into DDA in that manner and be prepared tomorrow to ask your questions. This is the DDA's feeble attempt to seek stakeholder input. Secondly, there's a link for Self-Directed Service Guidance and Forms webpage, the Self-Direction Act of 2022 that we refer to a lot, and the Self-Directed Service Manual that is the policy they dropped on the October 24th. There's also a link to look up your legislators. You know, we're all called upon at this point to advocate, right? So we're going to be asking that you and your team find out who your delegate is and who your senator is and be in touch with them. Okay, we really want you to understand that we don't have all the answers. SDAN cannot and does not have the answers and cannot answer all your specific questions. The following slides are merely highlights of the new policies. It is not a comprehensive presentation. It would take us half a day or maybe even a full day to do a presentation on all of the nuances and every detail that's in these in the new policies. Also, we understand, and many of you have agreed with this and have pointed this out to us, that these policies leave many questions. There's no details out to how they will be implemented or what procedures will be. So there are many questions, few answers. We recommend strongly that you as the participant and the family members of the participant meet with your CCS and your support broker and any other team members you have to dive into these policy changes and identify the impact that you expect in your life and be able to design your advocacy based on the impact to you, because it will be different for each participant. So please understand that we know we're not going to be giving you comprehensive information and answers to all your questions, but this is a start to kind of get you all educated.
So as you know, since January 2024, we've seen a significant increase in problems you all have reported to us. And the recent published policy changes of October 24th are just adding to that. I wanted to mention here that many of the policy shifts are in conflict with either the Self-Direction Act of 2022 or the 3 waivers. So you can keep that in mind when you're advocating. Next. So we want you to know that we absolutely share your concerns about the lack of stakeholder input regarding the impact and implementation of these policies and the loss of the choice and control, which is the hallmark of self-direction. We find many of these changes, as I said, inconsistent with the rules of the game, the waiver and the law. So once we all saw those the policy shifts in October, we immediately began advocating with legislators to pause the policy and to work really hard to get a legislative work group started so that that group can review and work closely with lawmakers and advocates and all of the stakeholders to go through all of the issues and to make informed recommendations to the DDA in terms of how to actually implement any appropriate changes. So today we're going to go through some major areas of the October policy change. The employer authority, hiring and wages, support broker service, the diminution of those service, individual family directed goods and services, and the increased number of hoops and steps one must accomplish, and the designated representative requirement for minors.
Okay. Hi, everybody. So the policy changes are, we feel, are affecting employer authority, and employer authority is a hallmark of self-direction, which is the person is the employer, the person sets the policy, the person sets the wages. One of the things that we note and we have brought up repeatedly to DDA is that self-direction did not receive an increase to the vendor rates and the reasonable and customary staff wages for the COLAs that or rate increases that were given on January 1st, 2024 and July 1st, 2024, right, which is over and above what the policy issues changes were in this manual. There have also been making changes to the wage exception form, most notably the need to advertise a position for 3 months at the reasonable and customary range rate, not the exception rate. There's two different meanings to the wage rate. The exception rate is the rate of the service minus 14%. That is the most you could give someone as a wage, and that would use up all of the funding for that service. They also want you to conduct at least 5 interviews and prove that nobody would take the job within the highest range rate, not the exception rate, before they will give you an exception. And then you have to justify and prove reasons on the exception form that you did all that. Only the CCS can complete and submit the wage exception form. And this will add an even further delay in the hiring process. It's also questionable what that means in terms of giving a long-term employee that we're hoping they certainly don't expect you to advertise to replace that long-term employee, and that you will have the ability to give them a higher wage in order to reward staying with the person and to keep them from leaving the person. We just feel that the whole process takes away employer authority and is burdensome for the participant. So apparently families working as staff have been able to get some overtime pay. In general, families are not usually allowed to work over 40 hours a week, but that has been something that has been happening if you can get DDA approval ahead of time for a certain situation. The new requirements are going to put a higher burden of proof to justify the need for that. And again, it's unclear how you would do that in situations where it's a weather-related situation where the staff can't get there, or someone has called out sick, but they're not going to the doctor and don't have a doctor's note and that kind of thing. Holiday pay is a benefit that people give as a holiday differential. Someone works on a holiday, as in any 24/7 operation, there's usually some kind of incentive to get people to do that. Now the DDA is taking away employer authority by saying it has to be within the certain reasonable and customary wage, which may or may not be possible, depending on what your employee's pay rate is.
Okay, so one of the next areas that we feel is some major changes regarding the support broker role. And one of the core principles in self-direction, right, is that each participant chooses the team that they need to support them, to help them self-direct, regardless of their disability, that everybody can self-direct, and that it's their choice who's part of their team and what those team members do. And the waiver clearly states, and the Self-Directed Act of 2022 clearly states the role of a support broker. But this new manual has some things in it that are more limiting. New policies that some of the things, that loss of person-centeredness overall is our main concern. The support broker can't access the FMCS portal without participant or designated rep being present. But access to that portal is really crucial for a support broker to do their role and do it well. It states in the new manual that a support broker can't contact team members, community partners, FMCS. A support broker can't make recommendations, right, on CCS agencies or FMCS agencies, or, you know, does that mean we can't share our experiences? We don't know what that means. No signing payment request if the participant asks. You know, sometimes participants get in a bind and don't have access to internet or might need assistance, and we can't do that. There's a code of conduct in the manual. There's not a code of conduct for any other vendor, anybody else except the support broker. Definitely kind of seems like they're targeting support brokers. If you have a day-to-day admin, you now have to have a support broker. There's some questioning about the billing and how that's going to look. There's comments about anything not used of those 4 hours being considered savings. So we're not really sure what that means. We've had the ability, if a support broker needs to work 8 hours one month and 1 hour the next, there's been flexibility. It's been an annual budget. With the language, we're not really sure what that means. And so we've referred a couple times to the Self-Directed Act of 22, and that's law. That's law. And there's definitely things that we're concerned about that are in the act that don't seem to be upheld in the new manual. The support broker works at the discretion of the individual. The individual should be choosing, with the help of their team, what that team member is going to do. So making informed decisions and arranging for, directing, managing services received, including decisions related to personnel requirement and resources, accessing and managing identified supports and services, and other tasks. And like we said, the list in the waiver is more extensive than the list in the manual. And that's a definite concern. And each participant should have the ability to choose what the support broker can do for them. And that seems to be kind of stripped away in this new manual.
Okay. Individual family-directed goods and services was an important part of the Self-Direction Act. It was also a subject of the Budget Reconciliation Act and a lot of this past legislative season, and they came out, you all came out and kept that in there. The kind of what we're seeing in this manual seems to be kind of trying to reestablish some of the stuff that the law would have done that didn't get passed. So individual goods and services are things that are not a cost added to the budget. They are paid out of funds from direct services. And so they can be any goods or services allowed by CMS. That was added by the law, and the definition of IFDGS was extended because of Self-Direction Act 2022. The goods or services supporting an outcome in the person-centered plan is important if it's for an activity or an activity fee. You need to make sure how you're pulling that back to the goals in the plan. Some of it seems self-evident, but DDA seems to be asking for very specific connections to that. Those would potentially be considered programming parts of the service. There are other things that are included, such as dental work, over-the-counter medications, and there's a lot of those kind of things included in IFDGS. The day-to-day administrator was a position that was established through the Self-Direction Act of 2022. DDA has chosen to put that cost into IFDGS, but essentially it's the same concept. It does not increase someone's budget. It comes from the savings from the rate for the services, the direct services that the person is getting. The $500 for recruitment and advertising, the way I'm reading the manual, is still an add-on to the budget, but you have to specifically request that if you want to have that funding for advertising and recruitment. Okay, so one of the biggest changes that they're now requiring proof that the person does not have funds to purchase any of these items, their own personal funds. They did remove the ABLE accounts and trust accounts as part of the funds that people would be required to provide proof of. They went 3 months of statements for personal bank accounts. Additional burdens would be the new documentation of what you have to have estimates, proof of costs. People have been asked to provide costs for camps, but that's respite, not IFGDS, but for things that you may or may not have an exact invoice for ahead of time, and a schedule to see how those activities will be attended. So they're just asking for much more documentation in order to get access to this funding. There is no description of how a person's ability to fund the request from their personal resources will be objectively determined. And since they are activities and part of the rate, my personal contention is that they shouldn't come from funds because they are part of the rate for the service. But that's to be determined. DDA has to approve all the requests. The waiver currently states that they will approve anything over $5,000 has to go to them. They have essentially amended how the waiver is being performed by this policy manual. And only CCS can submit it, as we said before. And a new thing that we're learning that has just kind of come to the forefront is that they're not allowing any IFGGS during auto extend. Since there's a lot of people in auto extend through no fault of their own, this is very concerning. There's no clear process or communication to participants regarding the request submitted or appeals process. People have officially received denials of IFGGS process in the mail that they can then appeal. That's new and an extra burden on participants. Again, my opinion.
We know this issue has been a hot topic on our Facebook page. And I know it impacts those of you with children under the age of 18, the designated representative. So they're now requiring it in this new manual for those of you that have children under the age of 18. A designated rep becomes the employer of record in place of that youth. If a relative, parent, step-parent, or sibling is the definition of relative in the waiver, is chosen as the designated rep, then they can't work for their child or the parent, step-parent, or sibling. So no family member can work if the designated rep is also a family member. A non-relative may be chosen.
Stephanie?
Yes.
The specific word is relative, not family member.
Thank you. Thank you. So a non-relative may be chosen to be the designated rep, and that we feel is probably the only way that you're going to get around then having relatives as staff. But it forces the family to make that choice. And the designated rep may not be a support broker as well. This, I think for a lot of families is going to cause challenges, and especially those of you that you have relatives working now. So I think this of all the changes, I think might be the one that impacts immediately. We're gonna see families struggle with this one.
So in the new policy manual, there is indication of a invoicing policy that will take effect January 1st. And this is invoicing for all vendors. And there is a vendor sample invoice included. And this is a quote from that invoice policy. All invoices must contain all these elements. In order to be paid by the FMCS, the name of the participant, the vendor name, the service that is being rendered as authorized in the PCP, the date the service was rendered. Here's the specific one that creates a problem. The start and end time of the service each day the service was provided, right? Number of hours, and they would like it in units, which is a quarter hour for each day. Name of each direct support professional who provided the service, and the description of the tasks completed by the vendor for each time entry and the total amount charged. As a nurse who's had a business doing self-direction since day one, this is going to be very problematic for your nurses, because nurses are more like a salaried job. We are, by law, required to be available, and the law says readily available to everyone we are delegating to at the time that they are working. The regulation in nursing also says that the nurse retains the responsibility for the outcome to the patient. Of course, they use the word patient in the nursing regs. So in essence, we are delegating the care to the DSP, who is also a certified med tech. So the nurse is working. The act of delegating is the job. Available the entire time. So there is no possible way that a nurse can give a start time and an end time to that service. So when this goes into effect, your nurses will have no idea whatsoever how to put this down onto an invoice without committing Medicaid fraud. If I write something fraudulent on my invoice, that is Medicaid fraud. So we are asking, I guess we're recommending that you all speak to your team and to your nurse. The nurse will have no way of knowing this. Most nurses don't even know anything about DDA policies, right? So they're not even going to know that this invoicing policy is changing. They will simply not get paid. GT is acting on this policy currently, and they've indicated, at least to me, that invoices going forward must follow this format or they will not pay them. And I am at a total loss of how to do that. So there's a lot of advocacy going on right now, but you need to take that seriously because it affects anybody with an HRST of 3 or above that has delegated nursing. So, and we did put a nursing PowerPoint in the chat or it's somewhere for you. Liz, is it in the chat or in the PowerPoint itself? I think it's in the chat. It does not speak to the invoicing issue, but this slide speaks to the invoicing issue that people are going to run into. So remember, this is only highlights. The manual is here for you to look at too. We suggest that you look at it. The manual is a lot of pages, but it is written in plain language. So it is not a technical manual. So you should be able to get through the pages. Talk with your CCS and your support broker about, again, how is this going to impact you and your team specifically? Design your questions that come up, because obviously there's lacks detail in these policies, and so that you can ask DDA tomorrow or ongoingly to get the answers to your specific questions.
So as you all know, because you helped us out, SDAN did a survey in October. That was mid-October, but prior to the latest policy changes on the 24th. We received 109 responses from you, and we thought we'd give you a little bit of information about what we garnered from it. So this is what she said. So one of the questions we asked is, why did you choose self-direction? 22%, excuse me, were unable to find community providers due to complex medical or behavior need. There was a history of abuse, 14%. The largest percentage, 50%, said it was because it allowed a person to choose their own activities, staff, and schedule. So the next question we wanted to talk about was communication between participants and the DDA. So the question was, if you contacted DDA this year, how would you rate their response? And an overwhelming 75% said it was a poor response. There were 13% who said they got no response at all. So, in your opinion, to what degree has the DDA changed policies since January 2024? And we asked this question because on some occasions when we have met with DDA, they have been telling us that they have made no changes. And it never felt that way to us since we'd been hearing from all of you. So we asked the question directly to you. And as you can see, 52% of you think there have been major changes made, and 32% said moderate. Only two people, and a very small percentage, didn't notice any changes. When we then asked about the effects the changes have had, 44% of you said negative, and 33% of you said very negative. So that's a whopping 77% of you who have felt a negative effect from the changes that we have all experienced. And I think there's one more slide. Yes. So then we wanted to kind of capture, as people were going through their PCPs, if they were told to reduce or remove a service, or DDA will deny your PCP or something close to that. And 38 people, 72% said they had received some kind of intimidating statement like that from DDA. And then the next question talks about, well, what did you do? What changes did you make in your PCP for DDA to be able to approve it? And pretty much a majority of you did something, either reduce the service intensity, reduce the number of hours, removed the service, or did something else, other change. So that kind of gives you a little bit of a snapshot as to, well, the good news is it gives us all a feeling that we're not alone, that the multitudes are feeling changes, whether DDA agrees that they've made them or not. And it also, I think these things can be used in advocacy, especially with your legislators, so that they get a feel for what participants are going through and the effects of these issues on them. They hear, I think, DDA or MDH's own views, which may not align with ours.
So we've dumped a lot of information in these slides, and you've heard a lot of words. So what do we do about it? Well, you know, I'm one of the old folks. You know, I've been doing this for a very, very long time, and people who have disabilities and people who have children who have disabilities, we always have to advocate from the time they were born or the time they had a diagnosis. So this is not different. It feels that way because we're feeling disempowered. We feel disconnected and not heard. The DDA used to meet with SDAN weekly for us to convey your issues. They no longer do that. The MDH and DDA used to care what we thought. They no longer do that. So we need to have some different some pointed and targeted strategies for advocacy. But the fact that we have to fight for dignity, respect, choice, control, all that, that's not new. So we're going to just dig deep, and we're going to keep doing advocacy efforts, and we're going to try to educate you some and energize you some to continue the fight. We absolutely love seeing the grassroots efforts. This is Adam and his young daughter, Emily, and a group of folks that impromptu, with very little time to plan, staged a rally in Annapolis. Some of you were able to get there. Obviously, lots of people couldn't get there because it was fast and it was in the middle of the day and it was just hard, but it made a difference. WMAR did a spot on it, and people's voices were heard. So it's just fabulous that somebody took it upon themselves to do this and invite everybody. So any of those activities are wonderful. And there's another group of folks that I think that were organized through the Maryland Council of Support Brokers that went to Annapolis. So we're going to look towards what are some more activities like this that can be planned, either by us or supported for you all to do, or one of you to organize. So we'll be looking. We'll certainly let you know as to what we can be putting together. So there are no plans for anything now. If you can all understand that, you know, the 6 or 7 of us at SDAN have been working round the clock about this issue. We haven't had time to plan yet what we're doing next week or the week after, but we will be letting you know. And if anybody else out there plans something, please let us know, and we will get it out to the masses of people on our mailing list if you're going to plan something ahead. So we will be looking ahead as to what we can plan. We do know that DD Day, Developmental Disability Day that is always in February, and we will be giving you some information on that. That is certainly one activity. But let's keep going on this. So thank you to everybody that showed up and wrote letters and made phone calls and all that at that time that this policy dropped. So we have a group of legislators that absolutely know and hear and know, I wouldn't say they're allies. They have supported disability issues. They continue to support disability issues. So we're asking for you to continue those emails with the subject line of Stop DDA Policy Changes for Self-Direction. Tell your story in one page. I had this, now I don't have this. Self-direction allows me to do this. I'm not going to be able to do this. So a simple one-pager on how these impact you. Specifically ask the legislator to stop the policies. Okay. Ask for a legislative work group. The legislature has the ability to establish a work group where there is testimony from all of you. Of course, the department will testify also, and the MDH and DDA will present their side of the story, but you will be able to be heard. A legislative work group gives us a platform for your individual stories to be told. Ask for a legislative audit. The legislative audit of compliance with the Self-Direction Act. We've told you repeatedly through this presentation that we believe the MDH and DDA are in direct violation of the Self-Direction Act with these policies that they recently published. So if you're so inclined, write your emails, write your letters, get in touch with your legislators. There's a list here. There's a link to find out who your legislator is. There's one particular committee in the House of Delegates. It is the HGO committee, the Health and Government Operations Committee. They oversee the activities of the Maryland Department of Health and the DDA. The chairperson of that is Chairperson Josephine Pena-Melnick. Many of you have been writing to her. She is an advocate for the truth. She will want to know what the truth is. And obviously, the department says one thing, we say another. She's an advocate for you and people with disabilities to understand the truth. Okay, so let's move on. So there's some action items there for you to do. Carol, you want to follow up with on this one?
Okay, some of you may remember that Karen Lewis Young, who was the delegate at the time and is now a senator in District 3 for the state of Maryland, was one of the sponsors of this bill. The other sponsor is currently the Secretary of State, so she's kind of out of the legislative realm right now, but that was Susan Lee. Senator Lewis Young suggested that legislators might look at a video better than they would reading a 3-page policy statement that we have been working on and sent to them multiple times. So we're asking if you're willing to record and send a brief video to SDAN and give us, that will send you further details to come, because we kind of pulled this together with it like a half an hour before this meeting started, to ask at this meeting for people to participate in that. To just explain in 1 to 3 minutes what we just asked you to explain in your letter, what you had, what you lost, and what the effect of it will be on you, so that they can listen to the stories and see the basis of the people that this affected. I want to reiterate what Patty just said. Delegate Jocelyn Pena-Melnick has been a tremendous advocate for us in listening to us and getting to the truth and helping us with getting to the truth is the best way to put that. And there are many other delegates who have picked up the mantle of this, and some of them might be yours. And so it's important that, and if they haven't yet, they may want to get on board with this. So please reach out to your own representatives, find out who they are, and get to know them. They're still in the district right now. They're getting ready to go back to Annapolis, but you might be able to meet them when they're down the street from you rather than having to trek to Annapolis. But getting to Annapolis in February will also be important if we aren't successful before that time, to get these policies re-examined. So please, if you're able, send us a video and watch for the email that will give you more directions and details. Thank you.
Okay, so here's, we're just highlighting again the Self-Direction Act. We don't have time today to go through all of the details of what is in the Self-Direction Act. Many of you participated in getting this law passed. The law, we brought this law forward, or this legislation forward, to protect self-direction. And it is the law of Maryland now. It is up to us to hold the state to it. So familiarize yourself with the Self-Direction Act, and you can see how some of the policies are not in keeping with the current law. Okay, so we are going to plan what was going to be today's meetings, a deep dive into grassroots advocacy and how you literally do it. We're going to have that presentation by Heather Sachs, the National Director of Public Policy for the National Down Syndrome Congress. We're going to have her do that at another time. But just briefly, time and resources constraints, the elected officials and their staff, they need quick information. They don't have time to hear the life story. They need succinct information. We call that the one page, or we call it the elevator speech, something you could deliver in minute. And so be concise and direct. Talk to their staff. The staff are extremely important. The staff are often powerful in and of themselves, and they will convey the information to the elected official. The fact that you don't get the elected official on the phone or an audience with them is not a bad thing. Speak to their staff and educate their staff. Choose one or more method to communicate: emails, letters, a little video clip, and in-person visits. Make it personal. I've been advocating and doing this kind of work for almost 40 years. And legislators will tell you it's the personal stories and the personal connection that moved them, that hooked them. It's up to other people to provide the technical language and the comparisons to the law and all that stuff. So don't hold back just because you don't feel adequate enough, that you don't have a grasp on the letter of the law or the letter of the policies. Make it personal and hook this legislator on your personal story. So watch for announcements. We're going to have an SDAN meeting on the grassroots advocacy, kind of the how-to, and how to write your story, how to present your story, and any other advocacy efforts that we hear of or that we put together for the near future. Again, we always give you contacts here. Let me say one thing about this one, and I jumped in. Somebody else might have been doing this one, but I'll just follow it. The offices of constituent services. We had told you last time that we discovered that when you make an email to the Office of Constituent Services, Wes Moore, Aruna Miller, Laura Vera Scott, all these are not the office of. Where's the email for the Office of Constituent Services? Do we have that?
For it.
I'm sorry?
So those are their links, their web links.
Okay, so that will take them to do it?
Yeah, and each, like the governor has one, DDA has one, MDH has one.
Okay. So if you use those links that are under this first column under Offices of Constituent Services and you make emails there, they are logged in the system, and it registers as that your email has arrived and what it is. When you email other people, it is not necessarily logged into the state system. So when they count, like, oh, we've only gotten 15 emails, well, that's because they're not collectively, logged in. But if you use these, they will be logged in under the Office of Constituent Services. So there's some other email addresses there for you. There's the HGO committee with Jocelyn Pena-Milnick, and the Senate Finance on the side of the Senate. It is Senator Pamela Vidal. So those emails are for information. They're not necessarily going to log your complaint necessarily. not in the state system. So you can look back on those and use them as you see fit. Alluded to the Developmental Disabilities Day at the legislature. This year it is February 13th. This is sponsored by the DD Coalition. They have it every year. And it is just a day that's designated that they'll have a small presentation in the morning, hearing from some legislators. You're free to be a part of the formalized DD Day by registering, or you're invited to just attend the day in Annapolis. The halls will be filled with people with disabilities. In the years past, there's been 600, 700, 800 people. So this is a good day to target and be in Annapolis, whether you do the official DD Day with that you register through the ARC Maryland or the DD Coalition, or whether you simply take that day to visit Annapolis and make your appointments with your legislators. You will see that you are not alone. And it is very powerful to see hundreds and hundreds of people with disabilities in the halls of the Senate and the House of Representatives. So again, have a one-pager, be ready with your talking points, and video clip if you have it, you could have sent ahead of time. So we do want to promote the participation in that event, but any other events as well that you can do with your legislator.
There was some questions in the chat about we had mentioned following the law and how many of these policies don't. One of the ways to actually get at the truth of that is to have a legislator file for a legislative audit. And that would require going through each piece of the Self-Direction Act and DDA actions and whether they match. So one of the things you can ask for if you wanted to would be a legislative audit. And we're working kind of with legislators to see if we can't get something like that going. There are two other things that legislators can do. They can hold a hearing. The chairman of the HGO committee has in the past held a hearing on particular issues having to do with people who self-direct. So we can ask them to hold a hearing where we all, it's what Patty was talking about, where we talk about how we're experiencing these changes, and the MDH DDA will have an opportunity to say what they think as well. But there's also the work group, which is one of the things we really want to advocate for. So we want to advocate for a work group that is not a work group sort of in name only. And that's why we would like the legislators to mandate a work group that would have mostly stakeholders and people who, advocacy groups, stakeholders, people who these things are impacting. Obviously, there would be representatives from the state as well. So just keep those in mind, a legislative hearing versus a legislative work group to work through those issues that we're experiencing. And then the last thing I wanted to let you know, because we've heard this too, that from the state that there was stakeholder input for these October 24th policy changes, and we're honestly unaware of anyone who was contacted. I think we can certainly say that SDAN is the only advocacy group out there that solely represents people who self-direct. We had a meeting mid-September. It was not brought up. The DDA had a meeting in mid-October with their new advisory board, was not brought up. Conversations with members of the coalition, none of them were informed in advance of this. So I don't know who the people were that they spoke to, but they're not they're not in keeping with how past administrations and issues have been dealt with. So I wanted to talk about that and just, highlight some of those pieces. And then Carol, I know you wanted to talk about the role of the designated representative, because there were a few questions about that.
Somebody had asked what the history was. So everybody hopefully is familiar with the participant agreement, and SDAN worked very closely with DDA at the time to create the participant agreement and to allow for an option where you did not have to choose a designated representative, that because it was the selection of the designated representative that took the control of the plan away from the participant. So even if the participant has a legal guardian, that legal guardian was not forced to become the designated rep, because the point of the self-directed team is to get the input of the actual participant, their wants and their needs, and have that be reflected in the plan. So by choosing a designated rep, that person then becomes the employer. So the participant agreement didn't require that. DDA policy didn't require that. So there's been a change now apparently related to minors. If you're a legal guardian or legally responsible person of a guardian, you might be being forced. Not that familiar with the minors policies. I can't address that. But the history was that SDAN worked really hard to keep that from ever being a requirement, that would only be a choice to select a designated representative. And I just wanted to say that before that got lost in the shuffle. That was one question that I noticed. Somebody asked about a consent form. Again, the participant agreement, it was kind of the consent form of who can work on things for your behalf. So if you want the support broker to be the one that's checking on these policies or logging in and doing things, it was always understood with the previous administration that the participant had the right to delegate any task they wanted to their support broker or anybody else on the team, which was the point of, again, of the participant agreement, which makes it a supported decision-making type of agreement, and not a taking of anything away from a participant and their ability to be part of the decision. I think that was all I had.
I think that the participant agreement here should cover, in terms of our history, SDAN's history with DDA, the participant agreement was intended to be a place where we had the participants' wishes documented for the DDA, so that if the participant wanted a support broker to help them, you would name the support broker and all of the tasks and duties that the participant wished to have done, so that it would be a documentation done by the team and changeable at whim about what that participant wanted help with and support with. There are many of our loved ones who are participants who may or may not be capable of being present at a 2-hour long FMCS discussion about the minutia of why somebody isn't getting paid. I know in our family we have that particular struggle to figure out here. So the participant agreement, I think, would be the document and the place where you would give permission, more that than another document. It's already there. Somebody else asked about why the ban on relatives if you have a designated representative that is a designated representative. And I don't really have a good answer for it. I only know what we were told at the time. And that is the DDA felt there would be a conflict of interest in terms of the family member controlling too much, I guess. That's the history. It's brief. And another few people have mentioned retribution and the fear of that. And while I understand that, I commiserate, empathize. The more of us who advocate together, the less that's possible. So if we stand together as a group, as a team, and advocate in a civil manner for what is needed, it would be hard for somebody to do retribution, because everything that's out in the light. So above all, I think we're transparent. We share our thoughts with each other. We share our thoughts with our legislators, MDH, DDA. This meeting is open. We didn't stop anybody who wanted to come from coming. Tomorrow's is as well. So that's how we stop it. We stand together, we advocate together, and we are above board and transparent. So there, go ahead.
Somebody asked if SDAN had input into the waiver renewal, and everybody had a chance to comment, and SDAN did comment, and the waiver followed the law. So some of the, and I haven't had a chance to look at the new policies and compare it waiver by waiver, but I know that the IFDGS, I did notice the IFDGS under $5,000 having to be approved by DDA is not what it says in the waiver. So the waiver pretty much followed the law. DDA at the time was working to comply with the law. And if you think back, the waiver went into effect on July 1st, 2023. Yeah, 2023. And it was in effect for 6 months before all of these things started happening. So the compliance issues that we're hearing from DDA are not really non-compliance with the waiver from before January 2024. And it's our contention that some of these things are out of compliance with the waiver as currently written.
If the manual supersedes the handbook, and I'm assuming it does, and that those things would be changed. We don't know what the trigger was for these policies because we weren't asked when talked, and we never had an opportunity to discuss them. Somebody was asking whether or not they're going to have all plans be rewritten. I would say no. They wouldn't be able to handle that workload. So it would be as they roll. And I think it's a great question to ask if, I'm just going to pick a little example that happened to people this week when there was a holiday pay or coming up in Thanksgiving where people who have holiday pay, and that's in your plan, your approved person-centered plan. How is it that they can approve a plan and then not allow it to be executed? I think it's a great question. I think it's a great question for legislators. That the point of it, the PCP is sort of like a contract. This is what our plan is, and somebody else is saying, yes, this meets all of the requirements we need you to meet. Go forth and execute it. So I think it's an excellent question. I don't have the answer to, of course, but it's a question that bears stating. Tomorrow. Again, all of you and everyone show up to this meeting, I think, and state your questions and your issues. We sink and swim together.
There have been a couple questions in there. People are asking, I think the ones I've seen were asking about employees. Does an employee need to become a Medicaid provider? The answer is no. An agency needs to, if they're going to track direct payment from Medicaid, needs to become a Medicaid provider to receive direct payment. Or a DDA provider needs to be a Medicaid provider. But in self-direction, it does not apply to us as vendors or employees. In the waiver, there's a whole set of requirements. Some are for agencies that provide services, and then there'll be a statement in the waiver that says, if you are providing services in self-directed, it's only 1 through 9, not all of these requirements. So I know I as a nursing vendor do not need to be a Medicaid provider, and neither does a direct employee of a self-directed participant.
But for purposes of providing services, you do have to comply with rules of being a provider, and you have to treat the person, you have to have the right certifications, you have to have the right training set, or the required trainings. And so there's this dichotomy in the word use of provider all people who provide services are providers. So therefore, it is my opinion, and I think SDAN's opinion, that people should get access to the COLAs for providers. That it's not just those fully licensed, directly payable vendors or providers that are thought of traditional. I use the word traditional for lack of a better term. But all people who work for someone under this waiver programs are Medicaid providers. They just don't have to go through a more formal process than becoming an employee or a vendor.
Right. So the words Medicaid provider would, to me as a nurse, would mean my business would have to be registered with Medicaid and meet all those requirements in order to be able to collect a direct payment from Medicaid. So that's how that is used in the industry. So we have DDA providers, we have people who are Medicaid certified providers, and then as Carol said, all of us that provide service are providers. But so it just depends on how people are using that language. They throw that word provider around a good bit.
Yeah, I think
There's
that's-
another question. Oh,
I was just going to say,
Stephanie.
We want these answers to come tomorrow. Like, we want to hear exactly, you've put this wording in here, you've made it very, broad and unclear, and we want answers. Exactly what do you mean by this? Because, we're kind of guessing at the intent of what they meant, but we need to ask DDA directly.
There was another question about the designated representative for minors, and I did want to go back to the participant agreement. Has 3 options. The person can doesn't need anyone. They're going to represent themselves entirely with no support necessary. The second one, I think, is you are having a designated representative, which means that person is de facto the participant and does all of the things that a participant would do. And then the third one is I want to direct my my services with the support of my team, and then a list of how that will happen. But the question was about a designated representative for minors and whether or not it had to be a relative. It does not have to be a relative. You can go ask your neighbor, your grandmother, the aunt. It has to be a non-paid position, but it does not have to be a relative. If it is a relative, a parent, a step parent, or sibling of the participant, then none of those people can act as a staff member, even if the person would choose so. So I just wanted to be really clear on if that goes into effect, what choices a person may have in order to protect their best interests. Any other major? There's a lot of very person-centered, individualized questions on there. I don't know that we have time to go through them.
I see a nurse question I can answer while you're.
Okay, please do. Yeah.
So someone is asking, why does the daughter need a designated nurse? So I think the term is what you're looking for is delegating nurse. So if a person, there's 2 things. If a person has an HRST 3 or above, they must have a nurse on their team because the nurse has to be part of that HRST process. Okay, so, but the need to have a delegating nurse, it is in Maryland law that if a person is going to be giving meds or doing treatments, and they're being, in any situation, school, assisted living, DDA, that staff must be a certified med tech, and they work at the delegation of a registered nurse. It is state law. I've worked for 10 years to budge that law, can't budge it. So it is a fact that if any paid person, family member or otherwise, is giving any kind of medications, doing any kind of treatments whatsoever, they must have training and they must be overseen by a nurse. So you will have to get that into the person's plan and budget to have nursing. Doesn't mean that in your mind as the parent that you think you need a nurse or don't need a nurse. It's not about that. It's about the regulations that Medicaid has. and the DDA follows, that you have to have a nurse on your team under certain conditions. You know, they don't much care about what we think about that. Just stands. Oh, there is a nurse PowerPoint that my daughter and I updated that is in the chat that Liz put in there. So if you want to look at that, it explains to the participant and their family a little bit about the nursing regulations.
Stephanie, there's questions about that 15-hour startup, or Carol, and how that works for a support broker. I'm not sure we have the answers.
No, so
for it in that.
traditionally, you know, this year I've had individuals that started in last January, right? Trying to transition over from traditional services over to self-direction or new and just new altogether. And it took months of working with the CCS, and sometimes one family had 5 CCSs over that 8 months.
Wow.
And I assisted them, and, you know, kind of that follow, you know, I put in far more than 15 hours, which is fine, right? But when I bill for that and have billed for that, I've been able to put, like, my start date might be March, and it would show all the months prior up to the start date. So if your plan's going to start on January 1, you wouldn't be able to bill those 15 hours after January 1. Now it looks like what they've done is they want all 15 hours in that first month, is how I read it. That's my interpretation. And you don't get 4 hours that month. You get 15 for the first month and 4 every month after for the rest of the year. So the big questions are, if you don't use the 4 hours, can it roll over? I have a lot of people that I have more than 4 hours, right? Their needs are higher, right? So they're saving. So we're able to add 4 hours comes into the budget from DDA, right? Like, you get 4 hours, but you could with savings, you might put 8 hours in if you have the need for it. It's very unclear. I mean, I don't know how to interpret that. So those are big questions. I'm working on I hope everyone is filling out that sheet with all of your questions. And I think we all need to bombard DDA with our questions. So.
I think, you know, this year especially, there have been a lot of support brokers who've been working with transitional youth, and they're by far, you know, been very time consuming, and many of them over a year's time. So I think there's a lot of issues surrounding the 15-hour piece, and then the 4-hour piece. There are quite a few of us maybe who have support brokerage who don't use a lot of it until we get around, you know, until something significant happens or till we come around plan time. So there's always the touching base. There's a consistent level, but it may go up and down depending on what's going on in the participant's life.
Right. It's definitely a service that is you want to be able to bank hours if you need to, like you're saying, Alicia. That's how you use them. You bank them, and then you use more certain times of the year. Or if our FMCSs are having major issues, those kinds of things. So.
Right.
Alicia, there were some questions through the chat that were about when you hire a vendor to provide personal supports, and that they will now be required to use an EVV system, and how's that supposed to happen? I saw Irene. Irene had some feedback from Christy. I don't know if Irene, would you be willing to speak on that for a minute? Are you there?
Yes, I'm here. Okay.
Did you speak to that issue? I saw 3 or 4 comments in the chat about it.
About the
when you're hiring a vendor to provide your personal supports or CDS, and and I'm not the one to speak on it, obviously, but it was about the EVV component when you're hired.
Oh, yes.
It's not a direct hire of yours.
Well, I did speak with Christy, and she did say that it is the FMCS's responsibility, that it always has been, for the well, I don't know, I guess coming back to CDS, but going back to personal support enhanced and respite, that they are supposed to have access to the portals in order to use them. to clock in and out. But I guess according to the manual, that's not going to be effective until January 1st. So that is something that I would like to follow up to see if there's any movement in that area. But in terms of like the invoicing itself, yes, we are going to be considered all Medicaid providers. And I believe that the purpose of that is so that way people who are not following the rules will be held at a different level of accountability that they can address. I feel like there is already like so many opportunities for them to hold people accountable that they don't take action on. So all of this, it's like we're all suffering for the sins of the few. Is really frustrating because I'm not sure if they're ever going to take ever going to hold people accountable. But yeah, so I've had a couple of questions with her. One of them was like what Stephanie said in terms of the 15 hours. That definitely is what the interpretation is. Christy understands that that's not reasonable. Just to be open with everyone, she did say that all of this it's coming from the secretary, Laura Herrera Scott. So they're basically following their directives. So, I've mentioned to people that if you do email Laura Herrera Scott and she responds like usually very nicely and everything, but I don't believe that there's going to be any change with that. But yeah, the 15 hours startup is supposed to be like that first month and nothing prior. And I'm not one to falsify documentation, so that's going to be really hard.
And I think, Irene, what that does, for those of you, you're assuming you're all in, right? You've all started. If you wanted to start and access your funding on day one, you cannot do that if you're not prepping months before, hiring and doing all that prep work that your support broker is helping you to do.
Yeah.
And is it an attempt for you not to get started for several months after, so those funds go unused? I think that's the question that I keep coming back to. How, what are all these things?
Attractive.
How are they helping them save money? We all think have to ask that.
Absolutely. We won't be able to help with applications. We won't be able to help during the enrollment meetings, which the ARC always invites the brokers to. It definitely, it's already a very mind-boggling process that can take months. And honestly, and CCSs are not going to be as motivated to be as supportive if they don't have a support broker helping along.
So let me say again, go back to our ask. There are so many unknowns. There's so many opportunities for these policies to negatively impact all of us. Our ask of the legislators is to stop these policies until they can be studied and until the impact on all of us, and until you all, as participants and recipients of the service, have an opportunity for input beyond an hour tomorrow. So, this is just like completely deflating, isn't it? We're all sitting there going, oh my God, how are we going to do this? I can't, we're all wondering, are we going to be able to keep doing this? So, but our ask is stop this nonsense. Stop these policies from being implemented. You were able through your advocacy to get it paused for 2 weeks. Don't give up. We can get this stopped because it's about you. It's about you and your life and my livelihood. We can get this policy stopped, but we all have to flood these legislators with this demand until it can be studied. None of us are saying we don't have to tighten the budgets. We don't have to tighten our belts. The state is in a fiscal crisis. We know that. Everybody I've talked to said we would take our hit if we have to, but this is not the way, right? So you have power, but you have to use it. SDAN can't do it for you. The ARC of Maryland can't do it for you. The DDA Coalition can't do it for you. Get those contacts to those legislators asking for the stop these policies. Have a legislative audit of the law. Have a legislative work group where we can give testimony and combat the lies that we think are being said about people in self-direction and what's happening in self-direction. So for those of you that can dig deep and have any chutzpah left in you, it's this is time. It's time.
Patty, that was a beautiful closing, but I wanted to ask, sorry. I can tell you because
Dang,
I'm so sorry, but I just wanted to
that's okay.
share. Okay, there's one thing. So there are a couple of questions that have been asked repeatedly about, like, can a support broker also provide other services to other people? You know, not like we know that you can't provide support brokering and direct support to the same person. But apparently it's not clear that, because, like, for example, I have a company, so I can provide support brokering for one person and another staff person can provide day-to-day administration for another person. And we're all, the same, but we would never, like, presume or pressure them to use our services for other services. Because that was my question to Christy. Like, how are they going to prevent traditional providers? I know they don't want to be called traditional providers, but how are they going to prevent them from basically doing everything under the same umbrella? And they're definitely, they don't have a system yet, but that is something that they are going to try to prevent. Because if they have like one wing that provides support brokering and then call it something else to provide a different service, that's not going to be freedom of choice. But anyway, that's one question. And the other thing too is that from speaking with the regionals, from Bianca, Tia, Christy, we do have too many people that are calling and threatening our DDA people. That doesn't
Yes.
help us. That does not help us at all. Can't call and tell them, force them to approve plans. Tell them that, that it's about the money. They hear a lot of horror stories. And of course, even about support brokers, falsifying invoices or just, forcing people to switch FMCSs and switch CCSs. So one of the questions was, what is provoking DDA to write these things in the manual? This is what it is. They're telling me this is what they're hearing. Families afraid of their support brokers. We can't have that. We have to be a more pleasant community, and show them that we're going to work together. Not like we can't force DDA to do anything, obviously. So we just think about that when we're communicating. That's all I have
think,
to say.
Irene, thank you. I think that as is in life, there are people who don't play by the rules, who are less than pleasant. But I think self-direction probably has less of those than in the general public. At least that's my personal bias. And I think we don't, you have a bad doctor. We don't say we're not going to have doctors anymore. You have a bad anything. All services, all places have people who don't play by the rules, and that doesn't mean that you eliminate everybody's choice about everything. You go for the people who are not doing the job as they are expected to do. And as my grandmother says, don't throw out the baby with the bathwater. So I feel like there's a large overcompensation for the few who have maybe misused funds. So that's not as uplifting a message, Patty, but again, I just wanted to have everybody get on it, get off the call, write your questions. There's a link for the questions today. Go on the call tomorrow. Patty, go ahead.
I'm sorry, we got a couple more nursing questions. Let me address them real quick. The nursing PowerPoint is in here. If you have basic nursing questions, go ahead and look at that. But so one question is about needing to have a nursing care plan and an HRST review for the plan to go in. There is no way for a nurse to do that service unless they are already in the plan and have an ability to be paid, right? So they have to already be a team member and already be in the plan and budget. to request it, and they do their service. Remember, it is a package of services. It is not simply an HRST. There is no such thing as getting an HRST review from some nurse. It's a package of services a nurse has to do. If there's not a nurse on the team, you have no way to pay one. Go back to DDA and say there is no nurse that can provide this. What's the state going to do about it? Maybe one of the 8 regional nurses will do it. Maybe they have contracted with a nursing agency that they'll do it. But if the person does not employ a nurse, there is no way to get that work done. Right. So the second question was, does a person need to have delegation for 24 hours? That's the nurse will decide. Right. So the law says that if we are delegating, we must be readily available to the person we're delegating to. So if I'm delegating 24 hours a day in this participant's home, I have to be readily available 24 hours a day. If I'm only delegating for the CDS hours, 40, that one staff, it's Monday through Friday, 40 hours, I need to be readily available for those 40 hours. But we don't know the people's schedules, so we're going to assume that we're going to be on call any amount of hours during the 24-hour period, right? So it is, the nurses know the rules. We know what our governing licensing body tells us we must do. So just speak with your specific nurse to get specific questions answered. But boot it back to DDA if you don't have a nurse on your team and they are requiring a care plan. Like you can't buy it on the internet, guys. It's not out there. You can't go to Amazon and buy a nursing care plan. So you know, give it back to DDA. It's their problem.
Right. Well, and the concern is obviously if they make it impossible to get paid, then none of us will have delegating nurses and we'll all be outside of the waiver requirements. And that's a big problem. I feel like there's a lot of evidence in these policies that show an ability or a lack of being able to look ahead to see what the unintended consequences or the implications of these policies are. I think it's true of the nursing invoice. I think it's true of a self-direction of the support brokerage changes. I think that's made impossible for the person who hires the support broker, who requires them in many cases, you know, because of their disability, to help them, to support them. And now you're telling them they can't get that support? Where are they getting that from?
So this is Dawn Stice. Hi, everybody. I just want to, I'm not trying to create confusion here, but I just want to go back to the question about the support broker not being able to do other services simply because, you know, I currently hold a contract with the Department of Aging and Disability for benefits advocacy in Anne Arundel County. And many times DDA recipients will come to the Department of Aging under that contract. Basically, the way the law is written now is that if I'm a support broker in the state of Maryland, I can no longer, through my contract with the Department of Aging, provide benefits advocacy for anybody that has DDA services. At least that's the way I'm reading it. And I just need to know, am I wrong in that? Because we're looking at a very short window, and that's a whole contract that could be, you know, gone if I choose to continue to do support brokerage versus, you know, right now I do both. Like, I just don't understand what they're getting at with that particular, and it's so vague, you know, I just don't understand what they're saying. Are they saying we cannot do that if it's a DDA client? Because the Department of Aging is going to say, we hired you to do this for any of our constituents.
Right. And Dawn, I think it gets to the fact that we need a legislative work group that needs to stop first of all, the manual is not the law, right? Manual is not law. Patty, Carol, Alicia, correct me if I'm wrong on that.
Okay.
You're right.
Right. So it can't make statements that are not supported by the law, which we feel that it does. And that's why a legislative work group is needed. And that's why the pause was good. But I think our original intent, SDAN's original intent, was pause it to get that legislative review, make the edits it needs, get the stuff out of it that goes against the law, right? And that's what we need now to advocate for. That's where we need all of your voices heard. There's a
Right.
lot of things in there like this one. I mean, it's pretty clear. It's page 54, 4A, and it states just what you said, that you cannot provide those
Right, but
services.
it goes a little bit farther than that, because it's saying if you have DDA funding in the state of Maryland, you can't access any of these other services because that person might be a support broker and can't provide them. And most support brokers do benefits advocacy work. So
I honestly see, sorry to interrupt, Dawn, but I honestly see an opportunity here for the support brokers in this crowd to get together and to kind of form your own little organization and help the participants outline the problems you see for them. So perhaps there's a way for, Irene, you've contributed some awesome information, and maybe some of the rest of you have also spoken to Christy on some of the items. Can you guys get together, have a conversation, and report back? We'll send it out to everybody. So
Yeah, so
I gotta cut it off now. I think, Dawn, I gotta stop, because it's a very specific conversation between you support brokers about everybody else, and it's valuable, but we're kind of at time. And
Liz, can Liz real quick, is there a way to copy the chat for people to copy the chat so they have all of those and all the comments in the chat? Is that, I can't find it.
I believe if you go to, it should say SDAN meeting, we're all advocates now at the top of the chat banner, at the top, there's 3 dots. If you click on the 3 dots, it might be because I am a co-host, but if I click on that, it says save chat at the top.
I think anyone can do that. I'm not so
Okay.
comfortable sharing, it publicly, but if people are here and they can save it. But
yeah, I don't think the chat should be public. Some people in there definitely wanted to keep their information private. So please don't share it. But if you want to contact somebody, at least you'll have the name of the person. Again, do you want to close again, Patty?
I want to say something before we go. One of the people asked about lawyers. We have talked to lawyers, but if there's any lawyers in this group, please get in touch with us, because we really do need an all hands on deck. And there are no lawyers on our board. So, please help us out if you see a legal issue, or just point us to something that we may be missing. So thank you.
So I guess we all have our marching orders, to whatever degree you can. If all you can do is meet with your CCS and your support broker and identify how these policies are going to impact you, and write on behalf of yourself or your participant to the DDA, ask your questions tomorrow, that's great. If you can organize a rally in Annapolis, that's great. And anything in between, we certainly ask that you write the legislators asking for these policies to be stopped until further investigation and a legislative work group can be formed, right? Yep. So any amount of advocacy is good advocacy. Just realize—
Go forth and conquer.
Yeah, we have to do it ourselves or it won't get done. Thanks a lot, everyone. Have a good day.